Hello everyone, Wayne Tucker here. In my next video, I want to talk about my experience, pandemic experience. So I figure with COVID-19 and the current pandemic, it would be good to kind of review my experience in dealing with the pandemic. So to start off, my background, as I mentioned in one of my earlier videos, is also an epidemiologist. So I've worked several years for a public health unit. I'm sure by now, over watching all the news, you probably have heard from a number of epidemiologists on the news networks and in the newspapers as well. So I had that work experience, several years working as an epidemiologist. Background, like I said, in several positions and management positions with infection control, managing infectious diseases as well. But in 2009, I was the director for public health for the Communicable Disease team, so worked in a number of programs there. But experienced the pandemic of H1N1 back then. Worked closely with the medical officer of health, as well as other health units in our local area. So the experience involved, we were lucky at that time because we actually did have a vaccine. So although we did, certainly my team was certainly involved with in terms of contact tracing and managing the cases for H1N1 influenza. We were also able to run mass immunization clinics, which unfortunately with COVID-19, we're not in that position probably for the next, it could be 18 months or longer. But I did want to kind of go through, I did have that experience being an epidemiologist and going through a pandemic, and just kind of provide a summary of my experience. So in terms of the mass immunization clinics, like I said, we were lucky to have that vaccine available. But running the clinics, in terms of in Ontario, there was, I think, 36 or 38 public health units. We were one of the first public health units to get started with our mass immunization clinics. And we're also very quick at hitting the grounds to do our immunizations. We ran a very successful mass immunization clinic, and I'll kind of go through some of the things that I think that we did that probably separated ourselves from some of the other health units at that time with pandemic. So one was that you have a huge community demand for getting the pandemic vaccine. So in terms of running the clinics, what I did was to run clinics almost every day. But ran the clinics every day at multiple locations. And what a benefit for our public health unit at the time going through the pandemic was it removed that kind of bottleneck. So if we decided to run just one clinic, you would be drawing people in from all different areas of the community to the one site, and it could be very overwhelmed. So by running several clinics per day, it removed the demand for people to drive an hour or an hour and a half to get to a clinic. So it was more convenient for them, and it kind of removed that bottleneck. Some of the health units in Ontario during the 2009 pandemic with H1N1 would have lineups of several hours. Some had lineups like 7 hours for people, which was very difficult for those who would be waiting that amount of time. Our wait times, I do not believe ever exceeded a couple hours, and we did everything to make this our line for the vaccine as short as possible. So it was another thing that we did during our clinic, mass immunization clinic, was to the people that would typically run the vaccines. So I had a number of staff, I think about 6 people that would be in the community on a regular basis doing immunizations at schools and other immunization clinic within the health unit. They were actually weren't given any vaccines for the most part. And that might seem a little strange, but they were the best people to put in the lead to actually run the mass immunization clinics because they knew how to run a clinic. And then I had to mobilize and hire additional staff, so people that were retired. I set up a contract with EMS for them to give immunizations at the clinics, retrain staff at the public health unit, that nurses that hadn't given vaccine for many years because they were working in other program areas like health promotion. So I utilized as many people as I could within the health unit and outside the health unit to have as many people as possible that could actually give the immunizations. And it was very successful. That we were did very well with our mass immunization clinic during the pandemic. But that doesn't mean that there wasn't things to learn. I certainly don't want to think that I think that's a good way to go back when you've gone through an experience like a pandemic, to think about ways that you could improve upon it for future. So in our case, one of the things, like we were a small health unit, so we're trying to do so many different things ourselves. But one of the things that, I think we could have done was a couple of just kind of the updates that we could send out to the community that would just be like a mass immunization, a mass distribution of a message to our community partners. So I think that was something that we could have done on a more regular basis. And even though I was doing radio, TV, and newspaper interviews during the pandemic, I think this was something else that, to kind of reach out to more community partners, I think. So one of the other things that I did leading up to the pandemic actually was I was going out in the community and helping municipalities as well as retirement homes, long-term care facilities with their pandemic plans. So to help them in terms of preparing for the pandemic. So and going through mock exercises as well with various organizations like the long-term care facilities or municipalities. So that was very valuable experience as well. Okay, thank you.